Ravi, the 10,000 jobs cuts are in addition to 10,000 workers who have chosen to leave through buyouts or early retirements. State and local health departments rely on the U.S. Department of Health and Human Services for expertise and a majority of their funding. Whether it's battling COVID-19, heart disease, or cancer, local health departments rely on the federal government's help to keep people healthy and safe. But according to Health and Human Services Secretary Robert Kennedy Jr., his department is far too bloated.
I have some good news, though. As part of President Trump's DOGE workforce reduction initiative, we're going to streamline HHS to make our agency more efficient and more effective.
Kennedy is slashing more than 10,000 health department jobs, including thousands at the Centers for Disease Control, the Food and Drug Administration, and the National Institutes of Health. 28 divisions of the health agency will be consolidated into 15 new ones.
Losing that much staff will impact our ability to have those important, meaningful conversations to keep our state healthy and safe.
Illinois Department of Public Health Director Dr. Samir Vorha says cutting so many HHS employees means losing vital experts.
We want the most qualified, dedicated people to come into these government spaces to protect our health.
Kennedy claims his restructuring will eliminate excess administrators while increasing the number of scientists. The massive layoffs comes a day after the federal government is taking away $125 million in extended COVID money from IDPH and local health departments.
This money was actually being used on the ground to help combat the spread of infectious diseases. Dr.
Vorha says the money is being used for disease prevention efforts like wastewater surveillance and preparations for public health emergencies. 65% of IDPH's money comes from the federal government. The Chicago Department of Public Health heavily relies on federal money, too. With the scaled-down HHS, Mayor Brandon Johnson is worried about future funding.
Just within CDPH, we're talking anywhere from $500 to $600 million in grants that the city of Chicago relies upon from the federal government.
Mayor Johnson says there will be severe consequences if the city's health department loses more federal funding. And besides the $125 million the state is losing for disease prevention, earlier this week, the Trump administration slashed mental health and substance abuse grants from Illinois. So, and there's no way that the state or any of the local health departments, including Chicago, have the money to make up for any of this.
These are enormous sums.
Enormous sums, and they're going to continue.
Very concerning. All right, Sarah, thank you for that.
Watch breaking news on YouTube. Subscribe to ABC7 Chicago Eyewitness News.